everyone, this is Dr. Liz, and you're listening to Include with Dr. Liz. This show is about everyone, all people, including you. It's about people and their diverse lived experience in this world. I chat with guests to get to know them, their identities, and their inclusion needs, so we all have an opportunity to understand how best to include them, so together we can create a world where everyone thrives.
James is a kind and caring, sometimes sarcastic, transgender high school student with a chronic and terminal illness who hates bananas and loves to write and draw. Proud of his confidence to express his true self, James identifies as LGBTQI+ and a cultural minority. In the future, he plans to apply his passion for makeup and costumes to a career in TV, film, and theatre. Welcome, James.
Hi.
Well, you're interested in makeup and love your makeup today. How did that come about as something that you love?
I found a show on Netflix actually called Glow Up that was like Great British Bake Off style sort of makeup competition.
Uh-huh.
And I actually didn't really like makeup up until then. I was like on the track of like I have to be super masculine like most trans guys are. And then I just sort of, once I became really comfortable with my identity, especially when I started testosterone, I was like, let's just do whatever the hell I want. I don't care how people really see me like in that way. It has had like effect in the way of like, I can't use a men's bathroom, especially when I'm wearing like makeup and skirts and stuff without like really bad anxiety. Like even in school, nothing's happened, but I'm just like, if I go in there, am I going to get beat up? Maybe.
Okay, well, I think we've jumped straight to talking about identity. No mistakes. It's not a mistake. One thing that our listeners are going to love is your absolute transparency and comfort level of disclosing everything. So I am so grateful that you've agreed to be here today. So how about we just kick off with your beautiful long list of identities. So just like every other guest, you completed a survey, and from the big long list, you ticked 8. What were they for you?
Well, for me, they were that I'm male, I'm transgender, I'm non-binary technically, and I'm LGBTQ, which is all of those. And then I'm also pansexual, polyamorous, demisexual. I'm a lot of things. I'm young. I'm a youth. I'm a cultural minority since I was born in Australia and I moved here 6 years ago.
Mm-hmm.
I have a chronic, technically terminal illness, but I think it does sort of fall under the chronic thing, and I am mentally ill.
There's a lot to unpack here today.
Yes, there is.
Which is what makes you beautifully, uniquely you, James. So let's help people understand where you've shared with us that you're transgender male already, and you started to share the story around getting comfortable in how you present. Okay. So you already said lots of transgender males present as traditionally masculine.
Mm-hmm.
And then when you were talking about your genders, then you then shared also kind of technically non-binary. So draw that picture for people that don't quite understand what it's like for someone that identifies as transgender.
Just between the non-binary male, which I know will confuse some people, non-binary just sort of means someone who doesn't fully identify with like fully male or fully female. So as a male non-binary person, I use like he, they pronouns. I don't like to refer to myself as just a male or fully non-binary because I like both of them. Quite honestly, I like any pronouns that aren't she, that aren't gender assigned at birth. But as far as life for transgender people, or specifically my life and some of the lives that I've seen from, I have a lot of trans friends, and I know that mine's a lot different than theirs because unlike a lot of trans people, I live in a really accepting community, which is really great. Like my parents, my family, it's all been like really accepting, and they've all just been like, we don't care what you identify as long as you're happy, which I know based on my friends and experiences that I've had, that's not the way that everyone thinks.
All right, well, let's just focus on your experience.
Yeah.
You talked about, well, it felt like you started to talk about the process of acceptance from others around you, but you identified as trans quite young, and my understanding is after a bit of a struggle with mental illness. So how do they tie in together for you?
So I realized and came out as trans when I was, I believe, 13. Yeah. I had a lot of issues with like depression beforehand, and even still, I was in like a mental hospital when I was 12 years old, which is relatively young. And when I initially came out as trans and had my friends and my family accept me, it was that huge boost of like serotonin of like, why do I feel this way? I do actually have people that sort of care about me and love me in this way. And sort of the longer I've been accepted, it just feels, it's still nice. It's gonna be nice, like however long, because it's like these people care enough about me to like accept me and who I am. But it's also like, it's not a full cure for mental illnesses. It's actually a lot of the body dysmorphia that I had, I didn't realize was gender dysphoria, which is something I just didn't realize. I just thought I hated my body because it just didn't look good and not because I was born in the wrong one.
So when you were so young and you're going through the mental illness, and like you're saying, you were confused, you weren't sure why you weren't feeling quite right, were there any specific resources that you had access to or wish you had access to that kind of would have helped you through the process more or better?
I feel like when I was so young, I didn't even realize what I was feeling until they're like, "Yeah, you're like not doing good at all." And I was like, "Oh shit." And then I literally, the day I found out I was depressed, I was in a mental hospital. Like I didn't even know that this wasn't normal because in school they don't teach you this. They pull up like, "Oh, some people are depressed and it means they're sad for a prolonged period of time." They don't tell you the specifics, especially not in like elementary, middle school, I think at that time. Because I'm really bad with my emotions. So I didn't even know that this wasn't normal, because I think if someone had told me, like someone in school or something had told me, or just anyone had told me that there are people that feel this way and that you're not alone and that it's okay to feel this way and that is help, that would have been really helpful. And now at this point, I have a therapist and I have hotlines saved in my phone, which is really great. But I feel like as a child, there's like not that many resources, because I guess people just don't assume that when you're 12, you're going to want to kill yourself.
Yeah, absolutely. Not to skip over something so powerful, but I will circle back to that. You also mentioned about your pronouns and around he and then they. And in the episode with your mum, she talks about how it's what it's like as a parent to get used to using the different pronouns. And that the they is more of a new introduction into the pronouns. So how does that come about for you when you really don't want the she anymore? Why is it so important to be called their other pronoun? And then why is the introduction of they okay now?
When I first realized I was trans, I actually, like, it wasn't a thing in my brain that I knew, like, I am not a female, like it is from like a lot of people that like they knew really young. I didn't know that. And so when I first found out, I like immediately had this sort of mental hatred towards anything she, because I was like, this is not who I am. Like I was very, very specifically, I'm he, him. This is me, accept me as I am, because this is what makes me happiest in my body, in being myself. This is what makes me feel good.
Yeah.
And then as I sort of like came down from that initial accept me now because I want to be happy and this is what makes me happy. I started thinking about like, is it just she or is it just I have to be a guy? And I realized that it's more like I want to be seen as a man. And most people see me as a man, especially since testosterone's made my voice drop a lot.
Yeah.
I just don't want to be seen as a girl.
Yeah.
That it's like, I don't care what pronouns you use for me. You could use any pronouns as long as they're not feminine. But it is the nicest to be seen as a man and use he pronouns, which is what most people call me, because it's like my identity, what I identify with, and what again makes me like the happiest with.
Yeah, absolutely. I mean, it's gender affirming for you, right? Yeah, no, good. And I should disclose that we're family friends, and even though inclusion is my thing, and we went to Christmas Day at your house and your voice had broken and you looked so awesome, like you was rocking the outfit, you got the makeup and jewelry happening, and I still wasn't sure if I could say your voice is broken, just like I would have to any teen boy. I probably would have said that. And then I remember saying later on to your mum, should I have said something? Because it's so cool, but I don't know whether I should say something. Apparently I should have said something.
Yeah, I think it's like gender affirming. Like, I love hearing people compliment my voice. One of my favorite things now is talking to people that I haven't seen in a while and just being like, oh my God, James, your voice. And I'm like, yeah, I know, right? It's like, it's really nice for people to like see that this is like happening. It's sort of like nice for me to be like, people are starting to understand that it's not just a phase that I'm going to get over. This is like medical intervention. And it's also really nice for people, like just surface level, to be like, oh my gosh, your voice sounds so nice. Because this is something that I like. I hated my voice before. I remember in choir, I had a panic attack when I had to hear my voice. Like, that's how bad it was. And now being able to hear my voice like this and people compliment how masculine it sounds is so like euphoric.
You're giving me goosebumps. I mean, I can almost imagine. So it's only for me, it's imagining, right? I can't completely sympathize in any way. So I'm just thinking the way you're talking about the female voice that you had previously, you probably heard it as someone else's. Like, it didn't even make sense that it was coming from you. Is that what was going on?
Like, most people don't really like hearing their voice out loud as opposed to
That's
it's
true.
Different. But it was so much worse for me because it felt like instead of just the sort of internal monologue, that it was like, it felt real. Like, it was so bad because it felt like I could usually ignore my dysphoria. It didn't come up a lot unless I was talking about it actually, or unless I was just already having a bad day or something. But like, hearing my voice out loud just made everything so much more real, that like, yeah, I am actually a female biologically. And it just made me feel like horrible.
How much does your chronic illness play as part of your identity?
As far as I don't really bring it up like verbally unless I'm joking about it with my friends. Like, oh, I can't do that. I can't run. I have a terminal lung disease. Come on, guys.
So we should, for our listeners, clarify that it's cystic fibrosis, yes? Yeah.
Which I have to take a lot of medication for. And so because of that, I have to explain it to a lot of people. So it's sort of just become a thing that's like, it's there, it's annoying, it sucks, but I have to learn to like live with it. And I've learned to live with it. I've learned to accept the fact that I'm not going to make it as long as other people, and then I'm going to be in and out of hospitals my entire life.
Yeah. And I always like to highlight this for listeners is that, yes, there's a chronic illness, but it doesn't mean that you necessarily identify with it. It doesn't necessarily define who you are.
A lot of the time, you wouldn't be able to look at someone and be like, yeah, that person right there, that's an ill person. That person's got some issues going on.
Some of our listeners, I think, will be parents or guardians of people that might be going through a similar experience that you're going through. And so this is a great opportunity for them to learn some things. Why don't we start with something a little fun? And a little birdie told me that when prom was coming up a few years ago, your mum wasn't sure like what to do. So she said, do you want to go and buy a suit? And your answer was, do you remember?
Not exactly, but I did end up going in a dress to homecoming.
Yeah, so I told you you wanted a dress and some heels, and your mum was trying to get her head around supporting you in every way she possibly could, and then trying to reconcile that with a dress and heels. So what advice would you give for parents when that kind of stuff is happening with their teen?
A lot of people assume that gender and like gender expression are one and the same. Like men express this way and women express this way. But they're not the same. Yes, I'm a man. This is how I identify. This is what makes me happiest, and this is what makes me comfortable and like mentally stable. But I like traditionally feminine things like makeup, like dresses. I wore a skirt to school yesterday. Like I look good. And it's like gender expression can be really fluid in that sort of way of like one day you want to wear one thing and another day you want to wear another thing. And it's like, it's not based on your gender. It's not based on how you identify usually.
Yeah.
You can wear and do whatever you want and still be a gender. Like a man can wear a dress and still be a man.
No, great explanation. So if I summarize that for our listeners, the gender we identify with isn't necessarily the gender that we present as, right? So what we're saying here is you can absolutely identify as being male, but you can choose any clothes you want to wear, full stop. In the episode with your mum, she talks about how you came out or made the statement with a cake, which I think is super cool. And but it is really about your confidence in yourself because you just went, here it is on a plate, quite literally. What kind of advice, and I know you said your parents are really good about it, but what kind of advice would you give to parents on how to best respond when the teen has the courage to share how they're feeling?
I think that something that kind of put me off immediately was my parents just looking down at me like, what? What's happening? So obviously there's going to be like surprise. If your kid's coming out as trans and like my parents have said, they had no idea. I mean, I didn't have an idea until I think 6 months before.
Mm-hmm.
But like when your child's coming to you with something like this, I think that the first response should be positivity and love and being like, hey, we have some questions, but we still love you and this is great and we support you. It takes a lot of like courage and confidence to come up. Even my parents, who I knew like loved me, in that moment, I was like, because I'd heard so many horror stories of parents not being accepting, I was like, should I be worried? Like, I didn't think anything would happen, but with a lot of people, it's like not like that. So it's like, it takes a lot of confidence to come out and do that, no matter how accepting and loving your parents are. Greeting it with positivity and like acceptance is the best way to go about it.
Great advice. Now, you mentioned how you've got many trans friends and you have heard the horror stories about how their families have responded. How about we give some advice to your peers, right? Friends of yours that aren't trans and that they have a friend that is identifying now as trans. What kind of support can friends give you so that they can feel safe?
I have a couple cis friends or not trans friends, and they just don't bring it up, which I think is good. Because I'm sure there are people out there that are like so sensitive about it. And there's something that I've learned about like when non-trans people misgender a trans person, it's such a big deal as opposed to when another trans person misgenders it, because we understand that the easiest way to go about it is just, oh, sorry, and then correct yourself. I think just not bringing all the attention to that, but if they like come to you with any sort of issue, then that's sort of the best thing. I think most trans people, especially if they have supports in their life that are trans friends or family or anything, aren't usually going to come to cis people about trans issues because it's like they don't understand. It's so hard. Like I can't even describe gender dysphoria to people and have them understand and like describe it well. So it's so much easier to just like have trans friends. But I think just sort of the same thing, greeting it with just acceptance, not treating them differently. Like just sort of, this is my friend. They happen to be trans.
Yeah.
They're my friend. They're still a person. Like I'm going to treat them the same.
Now we're going to dig in a little bit more to the network of a teen. So we've got, let's say, teachers around you. If we spot a kid that is, and this isn't necessarily just trans, right? This is just the mental health side of things for teens. If we spot something not quite right with a teen, do you think there's something a teacher could do, or how could they approach it with you?
Teachers are like mandated reporters. So I know a lot of people that just like aren't going to talk to them about anything. But I think it's really hard for teachers because I not what we're talking about, but I think they're underpaid and I don't think they need to be looking out for anything other than just keeping the kids safe and anything. But I think it's really hard for them because they have a room full of like 30 kids. But if they do spot something and be like, I think the best thing would be like maybe having a talk with them. And if they don't want to talk, maybe talking to a counselor. I don't know. I've never had a teacher like do this. I know that my younger sibling talks to counselors, but that's because parents already do it. And if parents have no idea, then I think it's sort of hard for the teacher to bring it up in a way that the kid feels supported, because usually you're not going to come out with your deepest mental health issues to a teacher or a school counselor that in most cases, you know that they have to tell someone if something's like really wrong.
Now, still within the teens network, and particularly that you're medically transitioning, what about the health system? Have you always felt accepted and not judged?
Like I said, I live in a pretty like good area as far as that goes, but it is the bane of my existence to go to doctors because every time when we're checking in, like they have to use your legal name. Like they have to. It's like medical records and stuff. So until I get that changed, which I think we're in the process of right now, every time I go to a doctor's office or like anything like that, my cystic fibrosis clinic, my general practitioner, even at the clinic I go for transgender health, I have to use my legal name, which sucks. My doctors are great about it, but it's annoying that every time I have to go to a doctor or I see a new doctor, my mom has to go and explain, oh yeah, this is my dead name, my legal name, but they go by this now. Doctors are accepting, just the system is not.
That's an interesting point. Okay, that's good. So I want to ask about something that you said, dead name. A lot of people won't know what that is. Can you help people understand what it is?
I know that some trans people don't, but if a trans person changes their name, then their old name, their birth name, legal name is their dead name, technically. It's just a name that is, well, sort of like by the term, just sort of dead. It's dead to the person. It should be dead to the community and everyone around them. Yeah. It's a name that no one uses, no one should use.
You now identify as a different gender and you've got a new name. With the dead name, what kind of response do you have when you're confronted with it?
Like I said, it's hard to explain dysphoria to people. It's dysphoric, which basically, as far as like names go, it's like, honestly, like just depressing to hear. Like it like makes me really sad. And even if it like slips out, like I haven't heard people refer to me using that name, but even hearing people around me who have that name or even like similar names to it, it's like, oh god damn it, it's just so uncomfortable and like sad, and sometimes like makes me angry. And I think I also associate it with a lot of bad memories that I have from my childhood, because I transitioned and came out and now I'm happier. Everything's like going better. But before that, I was not doing good.
Do you see people that you represented? So do you see yourself fairly and equitably represented in the media, TV, advertising?
Well, that's a question. Honestly, really hard to find shows that have trans people in it, especially ones that are well represented. I think the best one I found was this show about a trans girl, and that was like really great because it was, as weird as it may sound, Australian representation, which is something that I don't see because I watch a lot of American shows. But it was also the trans representation. But a lot of the time when you see in media there's a gay person, it's either like they're usually a side character. They're not like a main character, and it doesn't pay attention to like struggles, which is something that I look for as sort of like comfort. That's like the I'm not alone sort of thing. And
after the show, we're going to go find out what that Australian show was, and we'll put the link in the description in the podcast, just in case anyone wants to watch it.
Yeah, it's really good.
So when you introduced yourself on the identities list and you were sharing around your sexual identity as well, so LGBTQI sometimes can be confusing for people because the T represents trans, but trans is really a gender identity and the rest of the LGBTQI is more around sexual identity. So you reference things like pansexual, polyamory. Help people understand how that is separate to your gender identity.
They're technically separate, but they're very like intertwined. Your gender identity is how you feel about yourself. It's how you want to be seen, how you want to express yourself. And your sexual identity is who you're attracted to, like the other people, who you're attracted to romantically, sexually, in any way. And they're very like intertwined. Like before I was trans, I was a lesbian. And then I came out and I was technically straight. And then I found out I was pansexual.
Not everyone's going to know what pansexual is, James. Do you want to help them?
Yeah, pansexual is basically, it's described as being like gender blind. You don't care about someone's gender while looking for a romantic partner. All that really matters is like their personality and who they are.
So clearly your teens has been quite tumultuous. You've got a lot to work with. So with everything that you've worked through, how has romance fit in for you? Have you had space to build romantic relationships with people?
Yeah, I have a boyfriend right now, which is great. But I had a girlfriend in middle school and we both went through a lot of mental health struggles, so we just couldn't handle it. And I think that generally romance is really hard when you're going through mental health, but as I've sort of stabilized and not been in a generally low mood, it's been a lot easier to let myself like accept the fact that I can like love people and that people can love me. And like I said, mentioned earlier, I'm demisexual, which I believe means that I can only fall in love with people that I already know, which is definitely a big help. Like the guy I'm dating right now, we were friends for like 2 years before we started dating. And that other girl, I've known her since like 3rd grade. And then we went out for a little while.
You really are working through so much in your own identity as it is. So the more you know yourself, the better you'll be able to then allow others to love yourself for that too.
When I was like really low, depressed, my self-esteem was so bad I couldn't believe that anyone could love me, which is really sad, especially coming from a teenager. But it's like now that I've stabilized and I can understand, people can like me. I've got things to offer them.
Let's say someone's listening and they may be a teen or they may be an adult and they still haven't really come to terms with their gender identity. Do you have any advice for them?
Accepting that you're transgender or that you're not, your sex assigned at birth is hard. It is a really hard thing to do. There's always going to be someone who's going to tell you that there's something wrong with you. And I think that fear of, especially someone you know saying that to you, is hard. And it's hard to accept it like within yourself. For me, it was really easy, honestly. I had people that supported me around me. And so I'm definitely coming from a place of privilege saying this, but it was really easy to accept because my brain immediately thought, I saw a YouTube video and I was like, yeah, that's literally what I'm feeling. How did I not realize this before? And I was like, because I didn't realize like the social stuff that could come with being trans. Because at that point, I was really sheltered and I didn't even know what being trans was. Like, I didn't realize that I could lose friends because of that. I didn't, but I didn't realize that my parents could stop loving me over that, like a lot of people's could. And I think coming to terms with the fact that it's not always going to be easy, but it's definitely worth it in the end. I mean, that's something that I've used for my gender identity, for my mental health, for my terminal illness. That's something I use in life. Life isn't always easy, but that doesn't mean it's not worth it.
Sage advice. There's a bit of controversy around starting medical transitional hormone therapy for trans teens. What's your advice to parents when someone like you is absolutely certain about their identity? How do you help them get through that?
Well, my parents were really hesitant about it. They really only started accepting it when my therapist and the doctor at the trans clinic I go to were like, yeah, he should probably get on some stuff. Like, he's good. This is going to help him a lot. He's mentally like sound. But it's like, a lot of people say that it's really easy to get on like hormone blockers and like hormones. It's not. It's not just something that can be handed out. Hormone blockers aren't even just a trans thing. I have a friend who went on hormone blockers because she started puberty too early. And people think that doctors are just handing these things out to people who have the slightest whim. One, hormone blockers can be reversed. You take people off them. Puberty continues, and it's really great for a trans child or a child that believes they're trans, whether they are or aren't, to help themselves like figure them out. Like, put them on hormone blockers if they think that they're trans. If they are trans, keep them on them because it takes away that whole pain. I went through puberty because I didn't come out until after I finished puberty. I didn't realize, because that's when a lot of my feelings started to stir up and everything. But there are a lot of transgender kids that have those feelings before puberty, and those are really helpful. As far as hormones go, because those are the things that I'm doing and I actually did, there's hoops to go through. It's hard. I had to be in therapy for a year. My therapist had to write a note saying that this is what's good for me. And you also have to take a bunch of tests on gender dysphoria. I took like 3 or 4, and then I had to get like blood samples, a physical test, and I had to have like a 2-hour consultation with doctors at the transgender clinic before they gave it to me. I do injections. They had to show me exactly how to do that. They gave me a little packet. Like, it's hard to get on this stuff. And that's just in the US. It's not like a phase. And if doctors are allowing your child to go on these things, then I think at that point you can be like, okay, yeah, there's something going on that I should probably start listening to, because of these doctors, these medical professionals are saying that my child can have these things that can improve their life a lot, their mental health, the way they see themselves a lot, that's really helpful for them.
You have shared so much valuable insight for everyone today, James. I am so grateful for your courage and your transparency and on everything. So thank you so much.
Of course.